Good morning, good morning. It is 7:15 a.m. April the 10th, and I'm actually going to head to work in a couple seconds. On this topic, real quick, make it short and sweet. Your boy J Steve, and thanks for tuning in to Bronx, what? 83. Let's zoom in, let me see my face. I can say it one more time for you. Bronx 83. Alright, that's it, guys. Alright, so today I just want to talk about quick drug shortage. So pretty much in every hospital they have a formulary list, and what a formulary list does is cut costs of drugs that they don't really have to use, substitution drugs. Now I'm not saying when a patient comes in that they won't order a specific drug for that patient, take care of that patient's needs, or if that patient has that drug from home, they'll use it. This topic is not even good judging off the previous hurricane in Texas or in Puerto Rico, which apparently has one of our major drug distribution companies out there. But for example, for one drug, for example, Zosyn, Epi, sodium bicarb, Dextra is one of every hospital emergency use drug from ICU to the ER, Baxter. So when a tech comes into work and every day there's a shortage, it's an effect. And it's real, guys. It's a real effect. For example, you saw me pre-pack some Zosyns in one of my videos. And the technician video showing you my job, what I had to do. And pretty much if you have Zosyns, what you do is, obviously you can dilute it and you can put it into the fluid bag you want. But it became easier when they have mini bag pluses available. So if anyone knows Zosyn, most likely you're on a Q6 or Q8 hour dose. And if you have 10 patients on it, 4 doses, you're looking at 40 bag a time. So in an 8-hour period, if you don't have a mini bag to put together, you're reconstituting 40 vials. 40 vials. Pull, push, dilute, and send to the floor. That's a lot of work for your hands. Other shortages could be from fentanyl PCAs, morphine PCA, Dilaudid PCA, and we made these. So one of the things that make your job really hell is just not having the stuff you need or the products you need to even just complete a work shift. Every day it's a different thing we're out of. I actually was in the ER and one of the ER nurses was like, "How you doing today?" And I'm like, "Good, chopping it up a little bit." And he's like, "No, the real question is, what are we out of today, or what don't we have?" And that's true. Every day since I've been in the hospital setting for about 7 years, the drug shortage, you hit or miss. You get one drug one day, and then for 2 months you might not get it, from vancomycin to whatever, and then you get it. But it's so surreal when it's 2 months, 3 months, and you can't supply these drugs. And the thing is, this is our formula list. Now you might say, why not reformulate our formula list, which we do to accommodate common practices, but these are drugs that definitely do work. And the pharmacists and doctors, they put time into this formula list to make sure that patient gets the best care. I'm just saying the drug shortage is real. From fluid bags to just D5, we have to switch Zosyns to what's compatible. It is real, and it can make a tech's job really hard. Now, I don't know from a retail standpoint, when we were out of drugs, we normally just send them to somewhere, and somewhere, we get it. So I'm not saying that in pill forms, you're feeling the hurt more. I feel like in the pill forms, we're doing pretty good. I don't think we have that much shortage in the pill form, but in the IV forms, yes. Everything from your normal narcotics to your normal ready-to-use bag. I mean, pre-surgery, after surgery, a lot of doctors like to order Ansef, and you can't even get Ansef. And I'm not saying you can't switch from a ready-to-use bag to a vial, which we have done. So sometimes we have the luxury of having these ready-to-use bags that you just pretty much put a label on and it's go. But the thing is, sometimes you can get the vials in, which is Zosyns, Ansef, but then the bags are unavailable. You see what I'm saying now? So sometimes you have the fluid bags, can't get the vials. Or you can get a lot of vials, can't get the fluid bags. I mean, certain stuff just are diluents. I mean, from just sterile water, we have to be going from the 5 ml to 10 ml vial to using the liter bag to just reconstitute a lot of meds. And that can make a tech job a living nightmare. Alright guys, I have a couple questions that I have for me today that I'm going to answer. I think I'm probably going to do like 10 questions today, but I just wanted to make you know what's going on in the pharmacy industry today, especially for me at my hospital. And drug shortage is for real. It is so real that, like I said, you can go in an 8-hour shift. You might have, let's say you have, in an 8-hour shift, I'm not saying you don't do 10 drugs, but let's say you do 20 drugs in an 8-hour shift, and 20 drugs might be easy. Cardizem drip, insulin drip, all that. Easy stuff. Vancomycin, all that. And if you don't have the product, those 20 drugs become nightmare. Because now you have to find out what solution, what to put, where to get the vials. Instead of using the regular stock 20 ml vial of Cardizem, now you're using 5 of the 5 ml vials. And IV techs, you know how short it is. You know your hands are delicate to those syringes. So stay tuned for today. When I get home from work, I'll go ahead and do the top 10 question that was asked this week. Keep getting the question comes in. And guys, if y'all out to work, you see my video, have fun, have a good day, kiss your loved ones, and that's Jay Steve. I'm out.